All know to call 911 in an emergency, but what about 988? Those three numbers are going to change mental health for the better in a matter of weeks.
Ohio is launching a new hotline called 988. That number will not replace the National Suicide Prevention Lifeline. It'll actually be used in addition to it. 10 TV's Kiana Deiches is with us now here in studio to tell us how it works. Kiana?
Well, Yolanda, Andrew, the idea is that no matter where you are, you can get the help you need 24/7.
I can just remember sitting on the floor of a dormitory being scared out of my mind.
Hannah Thompson was a freshman at Ohio State when her roommate had a mental health crisis.
She was feeling suicidal. She was actively trying to think of ways to harm herself, and we didn't know what to do.
So Hannah called Suicide Prevention Services in Columbus.
They calmed us down. They asked us questions about the state of mind that she was currently in.
That 10-digit number became a lifeline.
That help is what has kept her alive to this day.
But many phone numbers for mental health help can be tough to remember. That's where advocates say 988 comes in.
We really believe it's going to make it easier for families supporting a person with mental illness or addiction to connect to care more quickly with an easier to remember number.
On July 16th, the federal government is requiring states to launch 988. The goal is to take more calls, provide local assistance, and increase call center coverage to include text and chat. Advocates say it's also an alternative to 911.
It will cut down on police calls, jail time, and also our emergency rooms, that sometimes become inundated with people that are in crisis.
When callers dial 988, they'll be routed to National Suicide Prevention Lifeline centers in each state based on the area code they call from. And Suicide Prevention Services will be one of those local centers taking calls. Some perspective about the need for this new service: from January through March of this year, in Ohio, the current National Suicide Prevention Lifeline routed about 15,000 calls. Over half of those calls were answered in the state. Ohio will have 19 988 call centers across the state, and the state is funding the launch.
In the first 18 months, we've dedicated a little over $20 million to that readiness and to the operations. We've done an actuarial study, and it shows that in year 5, that will cost about $34 million.
After that, funding will be left up to the next General Assembly. 12 years after calling a hotline, Thompson now manages suicide prevention services.
Suicide prevention, may I help you?
She says 988 will save lives.
We have gotten help to them when they have been at that pivotal moment where it is life or death for them.
And state officials say they hope to have 90% of Lifeline calls and 50% of text and chats from Ohioans answered in state by July.